All right, there's been a lot of chatter about this report from BC showing that in the last 20 years or so, the proportion of adults on treatment, on medication for ADHD, has gone up about 16-fold. So a lot more adults are taking meds for ADHD. Is this a good thing or a bad thing? Let's talk about it. So ADHD is a neurodevelopmental problem that's actually pretty common. Probably about 3% of adults in Canada have this. And we've certainly seen a trend over the years where more and more children are being diagnosed with ADHD and more adults are being diagnosed with ADHD. And in some ways, that's a good thing because people who have it are being recognized now. They're being started on treatment. They're getting better. But in some ways, that might be a bad thing because as we've seen a lot more awareness of this disease, we've also seen a lot of potential overdiagnosis. In other words, people who don't have it, who think they have it, and in some cases are being treated for it and inappropriately suffering the side effects of those medications without any benefits. And part of the increased awareness is all the discussion about ADHD on social media. In fact, we did a TikTok talking about some of the symptoms of ADHD, duetting somebody who had shown their symptoms a few months ago. And I think TikTok and other social media platforms are a great place to raise awareness about diseases. But this is a tricky disease to diagnose. So a lot of the symptoms of this disease are symptoms that many of us will experience. Really, it's just behaviors and processes that many of us face when dealing with the complex world around us. It's procrastination. It's having trouble focusing on one task, getting sidetracked and doing something else. It's having trouble keeping up with deadlines. A lot of these things are things that we all experience, and there's sort of a spectrum between this being normal human behavior and adaptive responses to the environment around us, and there really being a disorder. And people lie along that spectrum. The closer you are to the disorder side of that spectrum, the more you're going to benefit from treatment, and the closer you are to the normal side of that spectrum, the more you're not going to benefit, but you're only going to suffer the side effects. And the big challenge with ADHD is that there's no gold standard for the diagnosis. It's not like diabetes where you check your blood sugar and you either have it or you don't. Or, do I have high blood pressure? Well, I can check my blood pressure levels. It's just not the same with ADHD. It requires a really careful history. And because it's something that starts in childhood, part of making a diagnosis in an adult is actually digging into the childhood history. So usually getting this diagnosis requires an expert and requires several visits and several discussions. What you have instead online is often these questionnaires or these quick psychometric tests which will kind of pop out a score and tell you whether you have this or not. But that's really not how this should be diagnosed. And unfortunately, the treatments for it can have a lot of side effects. These are stimulants, so they can make your heart race, your blood pressure can go up. You can have nausea, vomiting, appetite suppression, weight loss. Some people have sleep disturbance. Some people get anxiety. So the bottom line is great to have this awareness through social media, but if you think you have this, talk to your doctor and make sure they take the time to really get to a diagnosis and hopefully send you to an expert center where you can properly get this diagnosis and weigh the pros and cons of treatment to really first determine if you have the condition, and then once you start treatment, to really determine if it's helping you before you commit to that treatment long term.